Yat shik eda shidne. Shady Perphelia Fowler and she my dish gives nin slon twitch ini bashin. Trapa edeshe adot asche edeshanale. Trotus aho yede ades tashike DJ eya kodo aho wado eya kodo nihil dahot nilne do hanna in hichona nilne ako alsahi to the zinlini be anil in kodoshin to the zindole. Kodan hojon dole shamana Hassan yadeshil. Zlistan twistan adokon chalhiel hayol khas no detui halchelti halchewan kadedin ani ni yajne awe ni blon nandi na konti bini biye ado di kon o ali biye yad kon ni hilnan hast ado le nasko ne nije injuno kon na hasan bakat na ne dado le asa ani zeno Adon hi kit adon len hitit ajahon ben rana holyado le ni hit istra ya anata hot etole trochil ini arochian chil ini ben hitra ya ana hot etole nasko ne neje sampi hina de yel krat ole nasko ado kon hitne etan lini kon hashine la ho ba it ino panaho it ado pansi kes Ado hashin soko konat nahat anlini ho nazlani ho yat ekon hinat at nanaslaro yat el hinse kes bitzilo nintinani kes ole ado kon hitine ba it edit no ho yat el ho ba nahuit ado nasko ne jakon be nanit edole hashine lago anin hinse kes ho and nazlado nihinahat at nazla Yat eko de nen lini ko da hitil zendo dan hitil zendo le nasko ne jakoni he ina silani beha na ini no in zendo le chamana hastan ada kon hitine askon lini ko baka batso dil zendo bakajo papa ini zen kon hitnas anko ni kon dan hiranon hi kon da tlin hi wonesh gishnas trango hon hi trotnas kango Yat ekon hislahot ato hashine la niho na khayeta konti de kosen tsan lini kon khanni nikitenen lini kon sa joba ata tsa kon lap nit apiketa hasti ajashi hot end la hon shitra in lini kon yat eko hon kon bichana ini nido sato hon nihin kesen lini khajo ni itla dole kon shamana hasan Konsago eya kon hinat lini asko big hujitli dole kon yat ehon nati kedole nasko ne neje nihitlat so the hon ben nanashni dole shamana hasan ado kon hichain himasan in hinaladan lini kon yat eko kon nada kedo yat ehon bas nada hasan dole ado tselke dan lini kon ta of train dal nish Bilik nazlani ho altri at eho. Kombina de yel krato le ho ichin yode esen lini dan ho sado le kon asko ne neje. Holzere to de zen lini ahon chen de kodo be nana shwedosha nadi yi dole ado altro hon nihe otla nazlani tati yin dole nihe yin do konta di yin dole shumanastan. Konsaga to the zinglini behanana si ole adine benicha wajanasli. At this time, we'd like to give it to Honorable President Ne Shana Kodoshi na Nahoji Jole na Heha.
All right. Thank you, Dr. Fowler, for the prayer and everyone who has started their day with prayer or starting to pray now. We appreciate the prayers for our Navajo people. As you may have heard now, or by now, we have received some good news yesterday. 0 cases and 0 deaths. And that's about 6 months ago. That was the last time we got to 0 deaths and 0 cases in 24 hours. I want to say congratulations to you, the Navajo people. But when I congratulate you, I'm also saying we can't let up, right? We got to continue to do what we're doing to push back on the virus, ladies and gentlemen. Ashwande, Adana e Kodon Hishone, Di Asaigia, Nadin Di Eskel Kitko, E Ya Dinas Nigi, Ado Asa Adin, Ado Beto was nada, Ado Saton, Ado Nitsa da Asaiche. Strand des Zident Dante Hut Ahon that Nikin Delia. Junichini Hinache. Hina Nishadas, Inigi Kodon, Shikado Shina, Nahashni. E what out e ya Nicha Hasito, that's Akonte. Ata Inosne. O Hanne Nijakonde, Ya Koni Hinte. Dini Chintoni Ze Vikidas, O Contra dato Ka. Ado A E Hanne. Jo E Di Bayel Tigi. Di Goya. Mask Chadas. Ado Yidigo Yadas. Ado Asanda Le. Do Hikeni Hidna. Bilkeda Huitinigi. Ado Tala Washto Nihila Betada Kis. Ado Ahagan Dasot. Nene Juti on Antini Kodelia. Eben Nache. There is no song. Yakoni, Kodo, Mado, Je, Masan, and Nalno, Linigi, He, Kodona Halchin, Ninda, Kregi, Nikade and Linigi, Dihanne, Kodo, Beyel Tigi, Kodoni, Beyadas, Kito, Kodoni, Halchin, Hikade and Linigi, which Ashana, that's the Egiben Nache, Yades, Kikunas, Ningi, He, Akonde, Hadainosne, Tashin Hada as O John. Dino Bayashki a hot ani nan shidel idoles naso ninja. Jut the Lagana Bikia the ahandi nasni. Ado Tashi denadel kid, denades kitjo hot chikedo shin. So evening na dino shik chidina. Yeah. Nihidini dole. Tuniheni hinachekon di beach di ka. Kon hanet hijikunda into the is not up and much. Now I want to say thank you for tuning in today. We got some folks from all over the country and all over the Navajo Nation. We got KABR listeners from Alamo, New Mexico. Greetings to our relatives in Alamo. Lisa from Chinle, Brooke from Texas. Good morning for all those that are listening from off the Navajo Nation as well. Karen from Mesa. Someone called Masa Get a Cat from Mesa as well. I thought I'd share that with you. Just some interesting handles out there. In our update, like I said earlier, with some good news, but we can't let up. 0 deaths, 0 cases in 24 hours. Yes, that's remarkable. And it's because of the hard work that each and every one of you are doing, Navajo citizens. Thank you. But let's not let that get to our heads and start, traveling. I know it's warm out there. We want to get going and visit people and others. Now's not the time, right? We say this every meeting, every session, every Tuesdays and Thursdays at 10 a.m. with the town hall meetings, every chance we get, ladies and gentlemen. You've done an outstanding job. Let's keep those numbers down here on the Navajo Nation. You see rises in numbers throughout the country in other states. There's different variations of the virus, variants they call it, right? You got the UK, you got the Brazilian and South African, I think, and others. And so we're starting to see those variants here on the United States, in the United States. but no verification of any of these variants here on the Navajo Nation. But we're going to start really evaluating those variants. But we have the ability to push back on this virus, and it's because of the Navajo people doing their work to fight this virus on a daily basis. So I'm going to give you an update. If you can put the slide up, Eli, today's numbers. Today's numbers are overall, and you can see the slide there. There are 30,007 confirmed cases thus far, starting from the beginning when we first had the first case, and that's over a year ago, right? Last week we commemorated, or if you want to call remembrance of those we lost, because last week was the 1 year anniversary of the first case and the first death here on the Navajo Nation. So 30,007 of our Navajo people have come down with COVID-19. There's much recovery, 16,331 recoveries, but I know the number is higher than that. Our focus has been a lot on vaccines. So we're going to get a better update on those numbers soon. And of course, our thoughts and prayers go out again, as always, to the 1,233 families who've lost loved ones here on Navajo. That's just counting Navajo Nation, right? There are other Navajo citizens that may have lost their lives off the nation, that live off the nation. We got to remember them. We got to remember our brothers and sisters throughout this country, their families who've lost loved ones as well. Continue to pray. You know, last Friday we had a day of prayer. All the faiths came together, a day of unity in prayer, and a day to talk about our resilience, about our strength, you know, and moving forward into the second year of this pandemic. And, you know, and then today or yesterday, we received some good news, and I thank the Lord for those numbers, because, you know, all the prayers that we do, God does answer prayers. Amen. Go to the next slide there, and it'll show you the progression again of the virus. I know these are repetitive. We update it every week for you to see, but we do want to be transparent and to let you know what's happening with updates, because it's important. An informed citizen is powerful, and to know these, to share this with your friends and your relatives, is the reason why these numbers are coming down here on the Navajo Nation. And you can see there, starting from March all the way to April 1st, during the September, in that time period, we see the time where we had 0 cases and 0 deaths. And then you see the progression after Labor Day. See, things that we've learned here, lessons learned, right, is not to let up. We let up as a nation, as a country, right around Labor Day. When it got warm, we wanted to go and visit and look at what happened. And the lessons learned here is that once the cases start going up, it is very hard to bring those numbers down. Look at right around Labor Day all the way to today. How many months did it take us to bring those numbers down? During the holidays, when people were gathering and family gatherings were happening, you see the spike in cases. At one point, we had 401 cases in 24 hours. Then you had numbers in the 300s and the 200s. And then we all rallied together to explain to our relatives out there that we shouldn't be traveling. And we brought the numbers down to today, to where it's at today. And these variants are starting to pop up all over the country, ladies and gentlemen. It is said that the United Kingdom, the UK variant today, 20 to 30% of the people are infected with the UK variant in the USA. The UK variant spreads a lot quicker, what scientists say, and also is more severe. And so we need to do our very best. And there's two things here that really can push back these variants. One is to get vaccinated. And we've been encouraging our people to get vaccinated. There's still vaccination events happening throughout the Navajo Nation. Check out our social media pages for the schedules. It's starting to slow down because we've gotten a lot of people vaccinated. But there are others that are waiting. Maybe they don't want to wait in the long lines or safe, And just joking aside, we're okay. Those of us that have gotten our second doses of the vaccine. And we would just encourage people out there to look at the bigger, the larger protection of our Navajo people, the greater good, as they say. One is to get vaccinated. Two is to continue to do those 4 criterias that I said earlier. Washing your hands with soap and water, wearing your masks, social distancing. I know social distancing, CDC is saying 6 feet. It's now to 3 feet. You know what? We as a nation are going to stay with the 6 feet, stay social distancing. CDC has been lessening their protocols, but we're gonna keep those very stringent protocols in place here on the Navajo Nation. And I know some of the CDC studies are saying you don't have to wear a mask if you're vaccinated with another person that's No, we're going to wear a mask, and we're going to continue the mandate on wearing masks, even if you're vaccinated. Please. It's better to be safe than sorry, because again, you never know if you have the virus. Even though you have the vaccine, you can still catch the virus. The only thing with that is the severity of catching the virus is less, but you can still pass the virus. And so continue to do those protocols here on the Navajo Nation. If you go to the third slide there, the third slide shows the comparison between the United States and the Navajo Nation. As you can see, as I mentioned, 3 waves. We have 2 waves here on Navajo. The orange is the Navajo Nation, and the blue or the darker is the United States. And you can see we're pretty low on the right-hand side of the graph at this point in time. Let's keep it there. Let's make a commitment. Let's make a commitment, everyone. Yes, we have seen some all-time low numbers. Let's make a commitment to ourselves, to our family, and our community, and our nation to continue to follow these protocols, please. It's not a political statement. It's not about politics. It's about our loved ones. It's about those that have yet to receive the vaccine, because 18 and under haven't given the vaccine. 16 and under haven't given the vaccine. Some of our people are out there that haven't get the vaccine as well. And so let's make a commitment to our nation here that we're going to continue to wear our mask, and share that with our Navajo citizens, please. If you go to the next slide, this is going to give you an update, again, a comparison of the Navajo Nation in terms of the vaccination summary. In the United States, 156 plus million total doses have been sent out to the states and counties and other areas. The total doses that have been administered is 126 plus million. And so that's 81% that has gone out throughout this country have been put into the arms of our the U.S. citizens. Those that have been fully vaccinated or received their second dose, and remember, this is Pfizer and Moderna, because Johnson & Johnson, you only need one shot, over 42 million people have received 2 doses. And so overall, 13.5% of the U.S. have been fully vaccinated. Now, let's go to Navajo Nation. Total doses that were given to the Navajo Nation, 221,325. Total doses that were given, put into the arms of our Navajo people, 191,064. That's 86% of what was given to us going into the arms of our people. Number of people receiving their second dose, 76,571. And then percent fully vaccinated, 37%. And so we're getting close to half of our people getting their second dose, or should I say fully vaccinated. Remember, Johnson & Johnson only needs one. And if they give one shot, then you're fully vaccinated. But it's between, 60% to 80% efficacy. That's the percentage that it pushes back on. Whereas if you get your second dose of Moderna and second dose of Pfizer, it's 95% effective and it pushes back. See, that is why we we encourage our people to get vaccinated, because these vaccines push back on the variants too that are starting to pop up throughout the country here. So we encourage you and we ask Navajo citizens to get their vaccinations while you can. And those visitors that are off the Navajo Nation, I know that we're not fully open yet, and we ask for your patience. But as you know, our visitors and our friends, we got hit hard here on the Navajo Nation. So that is the reason why we're going into soft reopening. It started Monday of last week. Our businesses are reopening at 25% capacity, and Navajo citizens only at the time at the casinos. We haven't opened our parks yet, but we will be reopening our parks, our lakes for Navajo citizens only. And that will be coming out soon. But again, you got to follow the protocols, even when you're outside, right? Don't be too close to others if you're fishing at the lakes or hiking in our parks, and we'll slowly transition. We got 3 resolutions that are there that are law. One is no visitors here on Navajo. The other is virtual only for our schools. The third is only 3 to 5 people at chapter meetings. So those are mandated by law. We can't change that unless the council reconsiders those. But we are mindful, and we ask the Navajo people to weigh in on this. What is your thoughts in terms of school reopening? Can we stay virtual all the way throughout the year? Because right now, that's the position of the Navajo Nation, virtual only. And we ask you, and Jared will put up a comment to where you can speak on these resolutions. And if you have something to add to those legislations that are being proposed, by all means, send it to us, send it to the council, send it to the Navajo people. So the Navajo Nation government, so we can know what your thoughts are on this. And we want to take small steps into reopening the Navajo Nation. You go to the next slide. There, it just shows you the public health response. And again, we thank the frontline workers. We thank the public health professionals. We thank our police officers. We thank our those that are on the front line on a daily basis. Thank you so much for the work that you all are doing for our Navajo people. You know, Vice President and I have been on the front lines. You know, we've visited chapters even twice throughout this pandemic. Now chapters are handing out food and supplies that came in from the CARES Act funds that purchased personal protection equipment, also food and hygiene supplies, cleaning supplies. So those are happening. So listen out for those non-contact distributions in your local communities. So if you look at the public health response, right at the top at 12 o'clock, right north, it says contact tracing to identify contacts and support early effective quarantine. So we have people, you know, just recently there was a group of, I think it was 5 or more people who caught the virus last week due to a birthday party. You see how quickly this can spread, but it was because of our contact tracers out there that slowed and stopped that spread there. So if you are asked questions, someone gives you a call about the virus, please be honest. Please give them factual information, because that helps us in keeping the virus at bay. You go to the around 1:30, if you look at this circle here and look at it as a clock, about 1:30, it says universal mask wearing, high quality mask. You know, for me, as you may know, I wear a face mask, the blue masks. And what I do when I'm out there, I cover it with a gaiter, which covers the mask as well. You could do a handkerchief. You can get an old shirt, you know, cut it up and cover the mask. And if you need masks, contact our Health Command Operations Center, and we'll send you some masks. We got some cloth masks that are have been made by JT Willie's shop, as well as TMC, and a lot of donations coming from various organizations. We want to say thank you to them for their donations, and we want to get them out. And we do hand them out at some of our checkpoints. We got hand sanitizers we're going to be handing out as well, donated by the help of Delegate Edmund Yazzie and Walmart and the Division of Community Development. So, you know, don't be shy. If you need some hand sanitizer, don't ask for a big old box, and don't sell it too, all right? It's for you, for your family's use, so that we can keep the virus at bay. So mask wearing, high quality mask, double masks is what some of us have been doing. The next at 3 o'clock there, social distancing and indoor ventilation. You know, 2 sheep length away, as they say, 6 feet apart, having conversation, indoor ventilation. You know, I remember my grandma when I was growing up. She would open up all the windows in the home just to let the air go through the home, to air it out. You know, that's something that we can do. I mean, Grandma already knew what was going on at the time to, you know, clean out the air in within the home. So that's something that you can do. Right around 4:30 on the presentations is avoid gatherings. Let's continue not to have family gatherings, social distance as much as you can. Wear your masks. I know that one of the protocols within the public health emergency order, the recent one, was now you can gather in tens, but you got to stay far apart. And, use your common sense, use the common sense of taking care of yourself and taking care of your family, because the responsibility really is on us now as citizens of the Navajo Nation. Government shouldn't have to continue to say and repeat themselves, right? We heard it for over a year now, and we know that. And you know that because we got 0 cases and 0 deaths yesterday. So let's continue to do that, is what I'm saying. Right around 5:30, early identification of cases and support for effective isolation. There's isolation and quarantine available for those that catch the virus. You got just call up HCOC. We got some hotels that are on and around the Navajo Nation that are willing to house you for 14 days. We're also rebuilding a isolation center here at Window Rock, close to the Window Rock Airport. That's going to be opening soon, and that'll be available for those that need to be away from their family to catch the virus. That there'll be a place for them to stay. Right around 6:30 or 7 there on the PowerPoint, protect healthcare workers. Let's continue to pray for our healthcare workers, and let's also help them, because they 1 whole year of COVID-19 takes a toll on the healthcare professionals as well as all of us. And let's not get a rise in cases to where they have to jump back into 24/7 operation like we were during the winter season. Right around 8 o'clock, protect high-risk populations or elders, getting them vaccinated, checking on them. We can check up on our elders without having close contact, right? Get them, bring them some wood, drop it off outside, bringing them some food and supplies, leaving it outside, saying, "Hey, my son, are you okay? Are you taking care of yourself?" It's really, again, up to us to check up on our elders, not the CHR or the chapter. Young people, I'm talking to you, you just need to call them. We got grandmas with cell phones now. Call them up and check up on them and see how they're doing. Right around the 9 p.m. mark right there, Navajo Nation COVID-19 vaccination program, vaccinate widely. And that's what we're doing. We're doing in at the beginning, there was this large vaccination drives, hundreds and even thousands of people getting vaccinated. As more of our people are getting their shots, the numbers are going down. So now's the time. Those of you that have been waiting, you don't want to wait in line. Now's the time to go to a healthcare facility and get your shot, please. And we do share our vaccination calendar on our social media pages. Genomic surveillance, those are still being discussed right now. We're looking at Institutional Review Board, IRB. That's the only way you find out if these variants are in your community. Of course, we do the swab tests and all that to find COVID-19. But to really know if the variant is there, you have to send the samples out and get that really in-depth test result to know if the UK variant is here, South African variant is here, Brazilian. So we are in the discussion of genomic surveillance. And so, ladies and gentlemen, that is our public health response. Let's not let down. Ada hosnya kodo bahosh negi ya kong banda huizna. Chikido shina. Ada inosnido hohamne ngi honda. Honde ingi bada hosna. I masudas ara yirgo ara yikeni na labes sanda le do keda hotnigi. Ara chinno sini ya keno sinigin le ha lagana bikaya da keda hotnigi. Kadoli Masani chain nada nastas ne bandahon bandano trash mod sa e ko aita the phones the halaya hado shne halant ash masana ashi ant eta bado no e ye hada ash ya ye da betzil doles konshik eno sin ashi bitshida atten aro e o Washington de bitshida de id ashkone nils konhi ska nature ibi chidika Çizdende koni masan içinde bande diyor. Aro çiyanda biçe konde ya hetan zindole. Aro bağda huyya. Çoğu bağda huyya do biçe de ti ani skot ani ya da ho ani skot. Bu hani hiç ko da ya. Da nan tina aita. Do idi ani nan tin eda. Şurada kadar hani doğru antinci kadar ya ben antinci o işi şunu antinci şimdi masan situation nala kadar antinci lene ben antinci so kadar hiç nasıl o haşkecin hiç yat arada da ne çok kadar masan hiç şey nala kadar hiç ya da da ise no şorta da ne Edo nan tingi nasi tito lesh Hiroshima. So kodo atom kada tsegin he kodo hijo badeni kirashon kodo di zen hijo koliagi ze na nishgi di kodo posinskagi na hast ets at ashkod hikeni hidna pa kada dots hidna pa put ban sde keso di beach di kacho tada do sa na ti hel kit asaj aro sa ni hitsa ajuten ni keri na aro sa beta oznada so ni hedat na antinigi komben that ni kino ibi chidi chik edo shinna ada ino snido o he ti yendo kodo bichets dilsna abe asin ko nakha illa kon Liquidez don hahania dort zu der Zemaila da initian da kommt zu der Zembaho ab zu der Zenosi benigo inanishidin daily ara daily nationada kondan de krigo zu der Zemse bgc kon zu der Zem nkhayad nayila din ishi ben nache kon beach in ikha so din bahashni ho dishnish keroshina in ben nache kodo hada inosnido da hosnido da din hista halora. So I just want to conclude by just saying thank you to everyone, especially the folks that are here on the WebEx, on the town hall. We got Dr. Jill Jim doing an outstanding job, being one of the generals here on the front lines, keeping the Unified Command Group together, Health Command Operations Center together, and moving forward in helping our people. You know, these are individuals that grew up just like us, herding sheep, running after the goats and the sheep and the horses, and went to school like mom and dad and grandma told us to. And then we came back and we're helping our people. And another one is Navajo Area IHS Director Roslyn So, who grew up in the Lichee area, went off to school, went off to Washington, D.C., Rockville, Maryland, became the head of the Navajo Area IHS, returned home to help our people. See, these are passionate people that care about our Navajo citizens, and we have support too, our friends, and really our relatives, like Captain Brian Johnson and Dr. Vaugh, who've been helping us along the way. And appreciate everyone's help in keeping these numbers down. Friends of the Navajo Nation, non-Navajos that have helped us throughout this time. And Dr. Fowler, always on these calls and giving us the teaching of our women, our mothers, our grandmothers, you know, and you know her presentations are very powerful, and I appreciate my sister, Dr. Perphelia Fowler for her work. And of course, Eli always doing the technology and the video to get the message out. And this is just a team, small team that's on the call today, but there are many others around us. And we surround, Vice President and I surround us with some very knowledgeable people to make these decisions. I know everybody looks at the president and say, well, good job, President. It's really the good job of the team here as a whole. And of course, you, the Navajo people, for listening and following through on these protocols. You got to be commended for the hard work that you have done throughout. And we're not out of the pandemic yet, too. Be strong, be resilient, just as our ancestors have been since time immemorial. We've gone through some trying times in our history as a people, and we've overcome that, and we've become stronger because of it. And ladies and gentlemen, this COVID-19 that has snuck into our homes, our communities, and our nation will also be defeated because we are strong warriors and we have the armor and the weapons to fight off this modern day monsters. Thank you so much for tuning in. God bless each and every one of you. Take care of yourself, follow the protocols, and we'll still see these low numbers in our communities. So I'll turn the time over to Dr. Jill Jim. Dr. Jim.
Thank you, President Kati. Nita hananing ziki kehe Kati. Ba keta nitin shi akui jin hat on hita yatio. Just not him my son don hit chasing hat on no hit ha at saying hita Kati ani Kati hansik so do hat east hit up ba hayato ishi bin yehikishin bin na kai hit ha at nita. Isn't been now cut or he had non do cut dot summa dot to power and dot party. So things and he had none. Although she that JK, she Dr. Jill Jim schedule Executive Director for Navajo Department of Health. Done and she look on so touching buses change or is she does it change or the fun it doesn't know. I don't know this I used to know so at least for her young J because in door. Actually, cruising, not that's a cruising, there's a quite a to question target, not it's out up in the initial heady. Can DJ and Captain Johnson, which I thought the door Dr. age and lead in Northern store. Kashi a quite health command operations center in Niki. President Nez quite our creature, quite Navajo Nation program. So if he and the initial quality, the question target, now states at our collegiate quality, yago, definitely, yago, that's it. You can add that up in quality or he had non kitty needle. Dodi quality, name quality, not only quality, yago. It, there's kidding the dodi, the question target, now states at the I should quite about the honey and dodi. The virus will get to only for her only for no bohanek. The mutations or variants will get Asian quite deep at the honey now. Asian quite hitching on his big ass kit or art on the streets on at the kit or at the ash at the hill indo. Asian a dark dancing off it on his hundred. Other she quite non-DPA quality under the Health Command Operations Center quality reopening Hulyanigi A Binatiki quality cases Hulyanigi to Jotiago Honi Photo quality in his and the hospital beds so that energy to Yegobi had there's Benogo A quality Jokani Hodnet. Quality to I use quite the never cut the hundreds gada. Do hot ashing in Dale Kako at Ado contact tracing to Yanigi to contact tracing and Yego A quite the hater had the question target, but then not go A quite not, but the kid left. How he shall be Jensen, your house, and send ya, but no crashing, not but the kid left. Asian hut the contact tracing got your hats off. Dubbing nothing, do quite cases are you the although non-niki vaccine the nail cushion, but I didn't hit in there. But as said, hut the nail of the it the public health orders, the even not quite the shelter in place, although safer in place, hut not they need it, do yeah go. They got in kicked out or they got some kicked out so yeah joke thought she cleaning desert that day January at a quite did that so the 300 cases a day in that AC quite the hot air up in Nike a been not quite the reopening the unity the NATO quite the safety team under the Health Command Operations Center a quite yeah going to cut they're with Indian Health Service, Navajo Environmental Health, NOSHA, and their risk management with all safety individuals that on this community mitigation team, a safety plans they a quality is here in Darnishako a the safety plan they they've reviewed it and they provided recommendations on those. Although CDC the the more is made at the Atlanta, Georgia, then one Kego Ada and Nika again, including the neck at the they're deployed now onto the Navajo Nation. Although casino who they do the Ajito Ada the safety plan, they ain't thought. These are, I would consider high-risk locations, but everyone has to have a plan to submit to Division of Economic Development. Although Nasagot the Michigan Parks and Recreation Aid, they'll provide guidance. Although transit, they'll continue to provide safety recommendations going forward. But under the Health Command Operations Center, I access Navajo Nation Dodi that any in the initial these are all quite the safety message and not English, so I'll go ahead and do that. I don't be hostility day I don't you lot Kande guess our creature that they know those at the news and don his on his epic ass get day news and dots on they cake though. Although these COVID-19 the question United States or the Haganigi, Belagonic actually we can say it's a silent spread too. So make sure you get tested. The testing Haganigi to are you quite the tested up at the end. That's a bit nutted though. That's the kind of that as shaky she thought that I thought I would add all the hot egg of being 98 quality about the understand the hit harness go do quality header. I use a kiss or aim the Israel ego dog glass. I would ask you quality neto. So get tested to prevent a silent spread of energy quality message and on this starter. Although the benefits of getting a COVID-19 vaccine though with our quality not only need some of the benefits is to to help protect you from getting COVID. Prevents you from getting severe illness from COVID. The questions talking that's not go to yet on no got up in yet though. Although the Howard Getson Danny the header Asian you will help protect people around you from getting COVID. Though header yet up at the door not up in yet thought the customs talking States are the although the high risk population that many do adon Muslim don hiche dan luni the those are the most at risk in our population. So if your elder at home or someone in your community hasn't get vaccinated, maybe you can talk to them and help them get vaccinated somehow through the CHR program or working with the hospital. Can a COVID-19 vaccine give you COVID-19? No, it will not give you COVID-19. The vaccine does not have the virus that causes COVID-19. Sometimes getting the COVID-19 vaccine can cause symptoms. This is normal because your body is building up immunity. Although some reasons to get vaccinated, as I mentioned, to protect others, yourself, our culture, avoid getting COVID yourself, protecting your immunity and building your immunity and helping stop the virus. Also, getting vaccinated is when it's made available to you. And Dr. Val will talk about the availability on Navajo for vaccines now. Continue protecting yourself by wearing a mask and other precautions we mentioned. So, with ego, they all tiso the legana do, the neck at your house street do. Adon, he changed on his zip because say I have one mask on right now, but these are not tickle with on Ben shot. So make sure you wear a double mask out in the community and public, especially if you have visitors that you don't know that are not vaccinated. So mask wearing and tight-fitted masking is still very important. And I know President talked about that a little bit earlier. Auto public gathering, avoid large gatherings. Auto, make sure it's only 10 persons or less. That includes any sort of public gathering or indoors or outdoors. There are, so that's the current public health order number 6. Although in the workplace, continue to take all the precautions, but my main message is to stay home. The button off Nishiki a quite hit is go a all want then daiso a quite dito behos and that's allergies so that's a unit that so make sure that you either way you still have to try to stay home if you have any symptoms. Although if you are a business or a customer and if you are aware of any exposures, report them to the Navajo Department of Health webpage, and there's a report exposure button. And you can report this and they'll have a follow-up and do a case investigation if there are individuals that are positive. And then although relieve stress and maintain mental wellness, Dishi Ani Hanza Ohol and Declaration, Tata di COVID fatigue, Kodyaniki, Belegonik, Etchen, Atishi, Quati, Hind, it's and the she Tata go exercise, go Inyanya at Ehegit, Da Sado, Adon Za, I guess not really meaning like make sleep as long as you can, but sleep enough. Alcohol and use and drugs. So avoiding alcohol use and drugs, and also connecting with your family. We've been in this pandemic very long, and President is right. It is really up to us at this point. Ado ashin here about the high needs and no about the high yado. I don't think Asian about the high needs and no Asian hood are quite the safety precautions they ocean day though. Ocean hood are here non hitting Dyson Gido quite egg at Captain Johnson Shin quite Hanado to A he's with the Navajo Area Indian Health Service, Doshi Bike, Doshi Dr. Val, Dr. Fowler, non, if you had none. Captain Johnson?
Oh, hello, everyone. This is Captain Johnson calling in from Navajo Area Indian Health Service. As with previous Facebook sessions, live Facebook sessions, we've joined to provide information. I want to thank Dr. Jim as well as President Nez for leading us in today on the conversation. And we certainly look forward to sharing additional information today. So today I'll be also joined with Dr. Vaugh, as mentioned by Dr. Jim, and she'll be sharing some information that's very specific. So you'll certainly want to listen to that. It gets into, when we start talking about the various color codes associated with gating measures and indicators, it's important to understand the various color codes. And so certainly join in, tune in for that. And I think you'll find that very interesting. But I wanted to just make a few comments as we lead into that piece. And again, I just want to take a moment as we have been experiencing this winter and spring-like weather across Navajo Nation the last couple of weeks. The weather can't decide whether it wants to be warm and more like spring, or if it wants to go back to winter. We're kind of in that phase of the year, and it certainly has an impact on how much we're indoors or outdoors. So it does certainly impact how we're approaching the COVID-19 as we continue to see a reduction in cases, and that's exciting to continue seeing that. And it's exciting to hear, the number 0 for cases, as President Nez shared with us earlier in this particular session. So thank you for that, President Nez. I know the numbers were shared, but I just want to reiterate just how well the public here on the Navajo Nation has done in regards to vaccinations. And, we're up in that area of almost 197,000 vaccines or vaccinations that have been actually administered, and that's a lot of vaccinations, folks. As we're nearing the 200,000 mark, that's really, really great, and we just appreciate everyone being so responsive. The Navajo public being patient. I know it's taking time, and we just truly appreciate your efforts and working with us the best you can as we've made our way through this vaccine effort. This is something that is unprecedented, of course, here in the public health system here on the Navajo. So we're all making history in terms of how we can come together, how we can make our healthcare system work and function to the benefit of the Navajo people. So again, thank you all and your families for everything you've done. I just want to also reiterate that I know that everyone has heard time and time again about the vaccines and vaccinations, and still want to send the message across Navajo Nation that the vaccines are the safest and the most effective way to protect yourself and your family members, your colleagues, and any others that may be around you, in order to make sure that we keep this virus suppressed, keep it down, keep the numbers down. It's very, very critical that we do what we can and use all the tools that we have to fight this bug. And again, it's amazing, but it's amazing the numbers that we've had of administered vaccinations across Navajo. But I also just want to reiterate, we should continue the fight. If you have not received the vaccine at this point in time, I do recommend, as the clinics are provided at the various facilities, that you definitely seek that out, and let's continue moving those numbers up, moving the needle up, so that we can make sure we're doing what we can. One of the things I wanted to mention is that from the national level, I think it's very interesting. We do communicate with our Indian Health Service headquarters out of Rockville, Maryland, very routinely. And when we look across Indian country nationally, what we see is that over 800,000, to be more specific, 814,000, almost 815,000 vaccinations have been provided to Native Americans, again, across the Indian Health Service. So that's very important to know so that we can benchmark locally how are we contributing to that overall national number, and what does that look like? And so I think it's something of value to say that out of 815,000 nationally, we're almost at the 200,000 mark here locally. So that gives you some kind of perspective where we stand on that, and I think that's outstanding. One of the things that IHS has set nationally as a goal is that by the end of March, that we would reach 1 million individuals vaccinated. And so we're getting, as we're getting closer to the end of March, it does seem that we will meet that goal, and very excited about that. We'll be able to share that with you as well when we hit that, and we're keeping a weekly monitor on that number as well. So I think this goes back to speaking about how we're doing as a healthcare system, not only here locally but nationally, in working in partnerships with our tribes, working in partnerships with our tribal healthcare organizations and federal Indian Health Service facilities. We're continuing to be in the top 20% for doses administered in terms of whenever we look at that per 100,000 people, we're still in the top 20% of doses administered. And so we look around at the various states and territories and various jurisdictions, and we can say that we're in that upper echelon. We're in the higher level of being consistently in this top 20% of making this happen. And again, that would not have happened if it weren't for in this case, the Navajo people doing what they can, traveling to your health facilities, traveling to the mass vaccination clinics, being patient and waiting, and letting others go in front of you and so forth. And you know, when we have the rural locations that we have, and a lot of the challenges that we have, just from a logistical standpoint, I think it's very important to realize just how well we're doing, again, as a healthcare system and as a people, working together to make sure we get through this pandemic soon. So again, we'll keep you apprised on how we're doing on that. I also just want to, again, I know it's been talked about in this particular session, but again, we need to use all the tools. Just because we're seeing those reduced number of cases, and just because we hear the number 0, we do know that the virus is still circulating, whether we're talking about here on the nation or along border towns or in the states or the regions that we connect with. It's still here, and we have to outsmart the virus. We have to make sure that we do everything we can to continue protecting ourselves, our family members, and we know what the drill is here, right? We know what precautions that we all need to continue taking. We've been doing this for a while, and hopefully we can all stick together and continue to fight this virus. This continues to be a fight, and we need not think that the fight is over. It's still a fight. We still need to do what we can. And so when we talk about President Nez and I know Dr. Jim, both shared information on washing hands, on maintaining your distance, wearing your mask. Those continue to need to be followed. And making sure that we're not going into crowded locations, making sure we're not having large gatherings as much as we want to. I think all of us want to do that. We're all social beings. We want to be with friends and family, and I really understand that. But if we can just hang in there a bit longer to continue this fight, then we'll certainly, it'll help protect our grandmas and grandpas. It'll help protect our parents. It'll help protect our teens. And if we can just hang in there and do that. So I still encourage folks to definitely, when you have the opportunity to get a vaccination, and it doesn't matter which one we're referring to. It doesn't matter if it's Pfizer. It doesn't matter if it's Moderna or Johnson & Johnson. The best vaccine you can get is one that is available to you at that time, and it can definitely reduce your risk of getting serious disease with COVID-19. The other thing I want to mention, just more so in ending, is I just wanted to take a moment and thank the U.S. Congress, the White House, and the Department of Health and Human Services. We've been very fortunate. When I say we, our healthcare system has been very fortunate throughout this pandemic in that we have received federal funding to above and beyond what we would normally receive. And at this point, we've received 5 different, rounds of funding under the what's referred to as the CARES Act. And that funding has been incredibly needed over time because of the way we've had to adjust our healthcare services, taking on new costs, and not being able to bill for services towards that we would have otherwise been able to do in a normal year. And so it's been incredible that we've been able to continue this fight, and we would not have been able to do that as effectively if it weren't for this funding. And then also more recently, many of you heard about the American Rescue Plan, and this is the American Rescue Plan Act of 2021, which provided a large amount, $6 billion for the Indian Health Service. And when I talk about the Indian Health Service, this applies to both our federal and our tribal programs across Navajo Nation that provide any kind of health care, whether it be direct health care such as a doctor or a physician, or if it's public health, any type of public health facilities that we're running or services that we're doing with coronavirus testing, with vaccinating individuals. All of this plays in. And then, of course, treatment at our local facilities. So I just wanted to mention those several things, and being thankful for the partnership that we've had with the Navajo people, with the Navajo leadership, with the Office of President and Vice President, with the Navajo Nation Council, as we've worked through a number of things, including water infrastructure projects, trying to improve the speed at which we're able to install those. And just working all together, it's been an amazing experience, and we want to certainly continue that. So thank you so much for that. And now what I would like to do is transition and turn the time over to Dr. Vaughn, who will be, again, sharing some information that's very specific to Navajo Nation, as she has shared in the past, and we definitely appreciate her expertise in the field of epidemiology. She's an outstanding provider for the Indian Health Service, and we thank her for her efforts. Dr. Vaughn, I'm going to turn it to you.
Thank you so much for that kind introduction, Captain Johnson. I'm going to go ahead and share my screen. And this morning, I will be presenting with our amazing Dr. Fowler, who's going to provide translation on this data that we are presenting today. And before I start, I do want to acknowledge, throughout this entire time, now that we've gone beyond a year of this response in this pandemic here in Navajo Nation, I am so grateful to work with this collaborative leadership, with this team, and I feel incredibly privileged to be able to witness the resilience and the fight of the Navajo people during this entire pandemic. And so I want to say akehe to everybody. And again, I'm just very thankful for that. And so I am going to present our data that really drives our public health response. And I'm hoping that it'll communicate with our public the risk where we are in terms of degree of spread within the Navajo Nation by communities and the risk to you, as well as provide some insight on some public health updates on the variants and our vaccine efforts. Dr. Fowler?
Yes, thank you, Dr. Ba. Kudoshe ba national Dr. Ba agent etse behahol jishe ihe ni hitjune ihe de deshni khala at satna khayfat api ika iwed not ani lini khata olni lanso else ihe bedeshni adati khodoba hanna egi bilganak eche data desne Ajin Sagondina al Kahlini Aj is kit not Tahido Nasnihigi Pahanegi Kodon his Ishja al Zanigi do Ayego Satopa Chana Nizino Eya Andoni no Kodope Akwijabe Nate ko Sato Eba Hensen he Sato dat Jene Databa.
So the first thing I would like to share is where we currently are in regards to what we call our gating indicators. And the purpose of these gating indicators is to provide us a way to look at that information so that we can understand where we currently stand in terms of community spread and disease risk. We are currently in level orange, and we look at multiple different things. Patterns and trends in cases, test positivity, our public health capacity to respond, as well as our hospital capacity to treat. And then as supportive data, because we understand vaccines play a huge role in this response, we are looking at vaccine data as well. And so we currently are in level orange.
Kodoya Hanana Zedi Nal Kahiki DA Ketnas Nelito na Kahi Adonle Israel Embasnahas Anotisk Epasnahas Ango Israel Embasnahas Ango Ado di Azetnini Ahatar Naiki Joeat di na Achahi Bewalt Kaogi di at Sopiki on ABE Ka. Ado di sohoki beach at nati kacha watch orange ni so ado nana yellow so jo koti at togi be kan hitne Dr. Ba.
So the first question we have is looking over 14 and 7 days, where are we in terms of our cases? And you see here the curve where we show our first wave earlier in March, April, May of 2020, and then where we hit our second surge in cases right after Labor Day. And you see how high that peak was. But since then, we have moved out of our second wave. And notice now the case is in that green bar, meaning that our number of cases are almost definitely less than 10 cases a week across Navajo Nation over a 7-day period for every 100,000 people, if not zero. Dr. Fowler?
DA Nahadnet DA Deeds at the Jedonle to Ginger Ajet Bernard Kahi Quadochana names kit. Ita Inle Nachayeta washed me Yizitlanta Okota Ita Ita the Hotza Anon Lake Kishmish nowadays yegon hits at the Hotza Yego des Kido or you ebetadosna. A cook at this change Sanach at Arch. Couldn't be none jo ado wash change egg a yeg on lato is gonna be naked Databa.
And so we understand that our cases are coming down into that green area, which is 0 to 9 cases on average over a 7-day period. The other thing that's that also supports this is that our infection rate. One person with COVID-19 transmits COVID-19 to less than one person because our infection rate is 0.81, which is less than 1. So not only are we in the green, our infection rate tells us that we should expect fewer cases.
DA ita the quest nas eight atapedi nini itil na inlay tos digit na kahigi ya asa apetil na kuch not is na ya to asa zint at end up betil na ta o at asa as zinjiko to is the ik apahazli to nasko ne sabenat the dos nita to unta as kai yenes Dr. Ba.
And when we look across Navajo Nation by these 8 service areas and then compare ourselves to the states, what you'll see here that it's most of the service areas in terms of the burden of cases over the last 7 days have moved to yellow or green, and Winslow's in orange. And so that tells us that this decline in cases and decline in burden is pretty well distributed across Navajo Nation and being experienced by a lot of the chapters across Navajo Nation.
According to the 88 service unit, Israel Embassy ano start and the second adonle ist ozaje aje dot is a go ya atza aje akwande di basin the j ati sit sok beginner kit akoti enle has trankje is it your kasi ot abe was go ya atza shikedos na Dr.
And our next indicator is test positivity. And what we would like to see is our cases going down and our test positivity going down. And so if you just focus on the orange line, starting from the very beginning of our outbreak, you can see it's something very similar to what our cases are. There's like a huge test positivity early on, and then it drops around right after Labor Day, and then another huge increase later, and now it's dropping. Our current test positivity over this 7-day period is 4%. And so we're getting very close to where we were in early September.
Di kwaenal kahigi enta al ka testing is niniki jodi sit sogi be o zogi edi danos en sit sogi Lena Hayeta to other nane ska a conle other kashmish Yuzeta Quayos Katna Hayeta the Nanata at a yamna des kitten late to the ginger a arjet not kata as any a nane ska asa besa bell trae and lay yatzage a tito ish to open zago a yatza Dr. Ba.
And next, we look at hospital capacity. These two graphs, side by side, shows us the percent of staffed beds utilized, whether it's inpatient beds or ICU beds. And what we don't want is we don't want it to hit that 80% mark or the 90% mark. Right now, our inpatient beds are clearly less than 80%, and the average of our ICU beds that are utilized is about 75%, so less than 80%.
Adadi Israel imbesnahas anokone di task etnas nili aje Israel imbesnahas anko yego ya atza di an ajako anal kidiki einle asa apesa beltra tebit bindo yagot enal kid akonde Nana Sajiki ICU bed isna intensive care ja aje ati dehot ako o ba ako nosendo les benia kodon hich ben hitlahan ezel etes epis nahas anko Dr. Ba.
And if you're wondering, do we have enough contact tracers for every daily new case? The answer to that is also a yes. Due to the efforts of the leadership of our contact tracing case management team and our public health response team, they were able to build this very flexible staffing and contact tracing. And so you see here with our low cases, we currently have 229 contact tracers. And so we have more than enough contact tracers for every daily new case to really drive our cases down to 0.
Aro di contact tracers de lini gi das ka lini AJAB ek at belah nel ado o you ek at das ka asa ajinje enatino ati das asa na as ka ko aje bi gato belah nel das kahi Dr. Bob.
All right. And so here's vaccine data. This is slightly different than what President Nez had presented earlier, and also slightly different than what Captain Johnson discussed earlier as well. And the goal here was to look at our population compared to what the US population is doing in terms of vaccine. There are 2 ways to look at this. The first one is using the entire population, all ages, as we journey towards herd immunity, looking at the entire population, all ages in the US versus Navajo Nation. What is the percent of that population that has received at least 1 dose or 2, at least 1 dose? So this is 1 or 2 more doses, and they will gain the benefits of 1 or more doses in the population. So you see here, across all age groups in the US, percent initiating vaccine is 25%. Percent initiating vaccine here in Navajo Nation, receiving 1 or more doses, is 57%. Now, if you really want to focus in on just those that are fully vaccinated and considered immunized, fully immunized, then for the US is currently at 14%. For Navajo Nation, looking at all the data that's been reported by all 13 IHS and tribal health organizations, is currently at 38%. Dr. Fowler?
Kodo edi is lini atal yaiki apenda nihinat lini President Nez yahod na ado Captain Brian Johnson do ako shikodo bahash na ige oyo sahot end jo adi ad and anle chinaj wal khatje adi nikikahoto statino asa kahoto Aj adi asla ape for bel traina kiyaj el kit aro at and bata asigi ya asa atot jean atit senta asa ape for bel trai aro dini hit the nepes kahot zoje aj adi yado ba jo aj el kit aro nana at and it's on hit the neba bata as bata ase adi na kato istoba te pizza da jo okden la e asa apesa belta ni hitenen lini adon le latino asa ni hitata hotoi konzago edkis Dr. Ba.
And so where are we, right? And what I just discussed is that for our cases, have we decreased over the last 7 days? Absolutely. Testing. Is our test positivity going down? Yes. Do we have contact tracers available to follow and monitor and guide our cases and contacts? Absolutely. And our hospital capacity, do we have the capacity to treat? We absolutely do. And so right now, yes, we are in level orange, and this is the 3rd consecutive week. But what we do know is that our indicators are meeting threshold levels for level yellow or better.
Di katle kha yi kha jonne akwati ash ani di the Coastal States at the nini it is na yahwan ni yahwan ni adon na al khan lini ki jo ajish stop ya atza aj to ya atza akwati ta as kahi to ajish to hollo aj belahnel adoti Israel ebesnahas ko teskesnas aj to Oh, yeah, at that edo task assassin bigger hotel ado dik asset sokun e kak at hage trat the more as li Dr. Ba.
And so what this translates to is that our degree of community spread is shifting from substantial community spread to moderate. And that also means to everyone here and to myself, everybody, when our degree of community spread goes from substantial to moderate, our risk for COVID-19 also goes down as well.
Ado di belakanik echo mother is nini a nad kahi bik eho jo aden ek asset so be I kako sit such that the ka ek upon za akwande jo abe eta akwi yant a ani nad kahi bik eho. Dr. Ba.
So, how do we compare to everyone else in the US and in our region? One point to this slide that I'm showing you is the curve for Navajo Nation versus the United States. The United States is in blue. What we're seeing in the US and we're concerned about is if you look at the blue line, it started to plateau at a really high level of average daily cases for per day. We're about 50 to 60,000 cases on average per day. Our goal for Navajo Nation was not to plateau that high or to go up. We really want to drive our cases down to as close to zero, if not zero, as possible. And that's what we are doing right now, as evidenced by that orange line.
Okatini hinako Nihikatahozogi Aj is Latino Asla United States nini Aj ati danal kit Okoti Aj dot isgo Bakaigi do Sachiti Nihin Hitnebahozoja Aset Soigi Okoti Nihinago Tahonil Aj ya is Latino le his hunting the media Jokonella ya asa aje betal na ka edi ni hinago ado di ni hin hit nebel ka hot zoje aje eten di adequate he kiden dashe ado sabados na do sabze hasli da jo a ya gonal kido enitsen Dr. Ba.
Next is this graph here. And it supports the efforts that we've been doing to try to get our cases down low. And this looks at the number of new cases over the last 7 days for Navajo Nation in orange, across the 4 states in red, and then also across the US states as well as jurisdictions in gray. Our goal with this graph has always been a race to last. And look how close we are. We are actually second to last, only above Hawaii. And so I'm hoping that by next week or in the near future, we could finally be last. And I'll explain why why we are striving for near zero, if not zero cases in a bit.
Di kwaya has neiki edi nihinago ado di la eyika jo the kui Desde danshe endle bakat nani dende kat endle we yate ye go yantes kido I see yaga okondle od na kikon etsi ka aj akwande ni hina go ti hos dojo yo to so le ado de pensa je atisa hotahin das kit to ja, gonta tos kis epanitzen kwande ni hin hit the nepes out so Navajo Nation dan hit the nini einlek at na kion na I ka ale elate di kata ebeka chana nitzen do adon le sata mo na asli je khai nas kitole Dr. Ba.
And so what we are seeing right now in terms of trends across the US is, yes, just more orange and yellow. But concerning trends is that trying to drive your case down to zero as much as possible. The reason for that is because you don't want to give the virus a chance to mutate or replicate into these more concerning variants. And we want to give ourselves the opportunity to try to vaccinate as many people as possible as we journey towards herd immunity.
Di kwa aya has na igi ni hinako at ni de ni ya isni go di jo ostoitini it edo sa on nisto ni ischi jo kwa ni na di kwa ya na had na ako eze paholla ako eze lini nakahata to nisto at inis se jonne esta tataba.
And so this next graph does provide us context of how we are doing in our region compared to our region. But as I mentioned before, it's really important for us to monitor what's happening in the 4 states, but also across the US. And what we do know at this time is what we are experiencing here in Navajo Nation is not necessarily what other states are experiencing. They're either plateauing high or they're actually seeing an increase in cases. And so you see that here, for example, with, as we look at Arizona, Colorado, New Mexico, and Utah. And then the other take-home message here is, there's definitely the strains to be concerned about, and that may impact their trends, as well as the degree of the population getting vaccinated, right? And so you see initiating vaccination, 1 or more dose, across the states and how we compare, with 57%, whereas other states are currently between 22 to 33%.
Di kwaenas kahi sto ni de ben his na huisne akoti ya ani sto yantes kiti hostoje ado di depend saje ati den nanal ke ado ya nanat yo toje ya des ke soleje ya na des ke akoti ni hin hil zoje yego ye ke konda an al kahidi peso bedol trai as ani akonde jadi cutting jo an al ka akonde di asa zina betatil na ido khane na such a benatil na at sk of nainil of ya na had na akoti dan ago yadi and hilkata hostoko 18 achito zeta da despale ati abene kido bende pane tataba.
And now onto those variants. And so at this time, in our 4-corner region, or in this region across the 4 states, we have officially reported the B11 strain, which is from the UK, the B1351 strain from South Africa, and then the P1 strain variant from Brazil. And so we know it exists in the 4-corner region at this point. We also know that, more specifically, Colorado has reported cases in the B117 strain and the B135 strain. So they have reported cases in the UK variant as well as the South African variant. In Arizona, we have cases also reported with the UK variant and with the Brazilian variant. Another variant that's coming up now that is a variant of concern is the California variant. And we do know that this is being monitored closely across Arizona, and it does make up about 20% of the strains that are currently being monitored here in Arizona. Dr. Fowler?
The variant is nini os doitini sahont or nisto sahot ani is chihiki 18 is katahas zogo san his ya isni akoti UK is ne at and so later your torch at was dojito the bensaj aj ya isni akoti the bensaj edis South African or Brazilian they nini isto jo eot andas ni higi sahon ordently ado ni benahon net jete yad ikhe hasne California de ade sahon ordently edo yego bikidini don lejos dogonet dat yahatos ne wala judo bahazenda jo yego bikidini don nail katane Bataba.
So you know, why do we care about these variants? The reason why is that these variants, to some degree, has been shown to either increase transmission from case to case, also has a negative impact on our current treatments available, as well as potentially also impact whether or not the vaccine is going to work. And that's why we care. The other thing to note is that if we continue taking precautions that were mentioned earlier, and we drive our cases down to as close to zero as possible, then what we're doing is we're reducing the chances that these variants really can spread and take a hold here in Navajo Nation.
DA yegon hit is ahto because the do na ha ni zini benina bikidini hala do nistan de jopahan na at Israel and don't ask Hayata has net and his ya is ni go is the bitch de bahidok at Nahata liai that's a bit of those knees that's a sato at all was jo eben na go big need don't del ka jonne a koti na a jashi yego ya at zande di ko eben de bahin hi chiton his zeta batata des palito adon zakoch ane tan ko neta ebini na kodo yego nikit is ahti a jashi tot it ain't das ninte jo eben na kodo ben hisnta huisne tava.
And so some updates is that we were just talking about variants. A very, some good news is that Navajo Nation now has its SARS-CoV-2 strain surveillance. It is available, and our teams are now collecting, as cases, the few cases that occur, are able to sequence our own strains here so that we can understand what's happening here in Navajo Nation. That is now available. Dr. Fowler?
Die Quan hit the Nebel Hahot, so AD SARS-CoV-2 desne strain surveillance so ARJ Satona al Kahi ni hit otane ka a sequence desne ako adat ni hit sato hit adat ostoit ini nail kahigi satat ni hit ni hit the whole so ARJ na al Kahi do kodo ben desne nail ka.
And now, second is that contact tracing. We continue to do contact tracing, and the reason why is what we are learning with work with CDC and with our public health response is that there is evidence that contact tracing has actually reduced cases and hospitalizations. Dr. Fowler?
DA da kahit ta nido ade sato nakasalani ki AD CDC will yani ajen da kahido koje an hinhi is the embas nahas agochin lijita hashin sakoti evidence will yani ki behozen bin nache AD yego ya at za don le is the embas nahas agoto at yat enta hot lehij aj sahol yena da kahiyena deska databa.
And next, with contact tracing as well as isolation and quarantine of cases and contacts is essential to maintaining those low numbers of cases until our population is fully vaccinated.
Arodin da al khan linigi khashin sakontabat al kahi it's a hoa de sentado, it's a ado sa as yugo na nanitapete nini hashin soko ajiti ya yoli. Ako anit and then asa anit no ze lini na hatalia petosni. Tataba.
All right. So lastly, COVID-19 vaccines. Navajo Nation is in phase 2. What that means is COVID-19 vaccine is available to everyone 16 years and older. So please come and get your vaccines if you haven't already. And I do want to emphasize that for those that may have already had COVID, please also get vaccinated because, we do understand that even if you've had COVID before, that protection doesn't last. And so it's really important that you still get vaccinated. And so, yes, anyone 16 and over, and if you've already had COVID, everyone, please come and get vaccinated. Dr. Fowler.
Arodi is lini pahazli khatnani ki jo ajati mi hid na bas khahat zo je phase 1 kun na I kha an za kon holri at 18 na ki kun na ati khe oko is pahalone at this trans at tapeta kheto tako twido sani jo is pahalla oko the question sanas at antol dante Nte edo zei anna hatod nisho edo baholnato desnini benache. Tataba.
And so in summary, thank you everybody for all the efforts on the ground, to the community, to the public, for everything you have done. And I know we are asking everybody to continue to put those safeguards in place because we're not quite there yet, but we are getting there. And so please continue to take those protective precautions to protect yourself and your family. And thank you to everyone. And thank you so much, Dr. Fowler, for helping us with this presentation.
Thank you, Dr. Ba. Kodoi o hihe nan histo ni do tada an hi ni tad ya do sato nasro ba he ni zin hijine. Nana kodo ba nasle Captain Brian Johnson his kodo area office do agent jilnish ako sido sa he the nation di Dr. Jim ado president Lini Hajin so his nishi ba he ni zin ado di Dr. Va kodo ni di yan hasna do kodon his ishta na yotli akodi nda aje be kit it Ecuadorian his ishta yilla ada ni ya ni ban his the haja okoti kodonat anin lini yisato yego kod an his no ya atza he had nabadish ni ko anhinat an lini president nes yisabana dish ni di is bahazli khatnani ki jo kat na kidneza tin de miliaje aj ade il kid ko ba ni zendoti de nebel hot so ja aj il kitten de nisha but lady ka ado and is el embasnas ando aj to he beti nido le ado ni he the neno sinis twi sani ni and has ango ni hito he ni hito sato ta Arodi is bahazli khatnaniki ejo an he be eta akhwasiado be eta akhwilya ajashi kodo abit ne baho sahoya aton nito ajashi ya atzante ayego ni hit adolto nitzen akoti dan ado dini ashlatino asabes khataho zoko national isne Aj young le Rockville, Maryland, jo ada izel in Basnahas ano tishtlijik. It is in Aj ya hashin tukati se bidneza tino ashlat tahte milyaje akone la is lini ahatalia doti nihit net yata betishtliji dahi kaja koti lady zilin le dizli your kalige asa the nezna tinda de milia jadats aj bihti ka ako he nihiti ne nihitne ade ge ikisna anishit ye go ba hensen Ajashidi ya atzande di atinasni hot a koyego be eta akhwatiado is in lini tahonahata ne inahata ne ado di do kenahat gednahas aja not ani or you aja ba hetnesi ado zel ebnaz aja di anti is klejibnaz aja zel ebeta but ochni ed o hehe dik at ishtlaat at di peso no tahaj aj don't hit na da ya zel ebnaz ano a copeso o you the meal so as tra de nezatin the meal so jokone la on such na da des ide aj American Rescue Plan de ne a quando nasco net ne jeti ihisen de ne sho Estadil nisto ni hitene pa ut a koto e sato be ne luto le stanne o kon soga e koto ba atna wishne do le ado asha saznido shikedo shidne koto athanne o aye gonan ato shido osh ato be yen tashin kin sto o ko ans tsinye ta shnala pa athashne o khato ji Oko naka alchinin hi token hi naliken lini hajo bebeta hos it's thinking way back when I became interpreter for my paternal maternal grandparents and still to this day for my parents. It gives me great honor to know my language and to use it in this fashion. I started interpreting for my paternal grandparents at a young age, probably most like that I remember and understanding in a grocery store, some of the things that, how do you interpret? How do you say your dollar amounts? How much are they saying? What's $5? Isla peso. How do you say 25 cents? Na kiyal. Those are some of the things that I started interpreting at a young age. It's been a year, and thinking back, when I was asked to speak at my first town hall a year ago, one of the things that brought to light was, who is my audience? How am I going to deliver what needs to be delivered? What are the technology capabilities of my people that I'm providing the information to? What language do I use? Do I continue to speak the Navajo language? And to make that long story short, I had to readjust my language. Not all of our people understand the Navajo language. So with my deliverable today, I have to use the English language, which I will continue to use and share. But the understanding of our Navajo language is really important. It's really direct. At times it could be harsh, but there's some adjustments that I had to make with the technical difficulties that our Navajo Nation has, the lack of understanding of the medical terminologies, the lack of interpretation for our people. I often think of the families that have lost loved ones within the hospital. What kind of interpretation was given to the family in dealing with the responses, whether they're positive, whether they're negative? It builds strength. It builds positivity within yourself. To engage my staff, my colleagues, it took time. So much, we found out that much is not in place, and it had to take a pandemic for us to realize what is really needed for our people and for our communities. We have to share new ideas. We have to build on our opportunities. We need to reinforce our values and our goals, not only within our homes, but within our communities, within our workplace. The increase of our engagement needs to happen. We really need to invest in our children and our grandchildren. We need to not just focus on the monies when we talk about investment, but to focus on our safety and our survival skills for our next generation. I often wonder, how is our youth going to look at this in 10 to 20 years if there's ever another pandemic, God forbid? Is our young people ready? We talk about schools. There's so many parents that have taken in their children back under their wings within their home. There's a lot of learning within our education system. And with what we've done, we're adjusting to new norms. We have to be kind, be proactive, and learn to practice acceptance within our home. We have to adjust our expectations within our home. We have to focus on what we can do and not to focus on what we can't do. We had to go on being polite within our home and to maintain a healthy habit. Our demand of learning online has increased. We're collecting more and better knowledge of our businesses and offices. We need to enhance in our reading skills, creating proper support within one another. The most important thing that I'd like to indicate is building a network. I myself had to really elaborate on getting a Facebook account, which I really kind of avoided. However, in building new connections with subject experts is very critical. Not knowing that I'm going to learn a lot from many healthcare professions, doctors, nurses, epidemiologists, and then all of all divisions and programs, law enforcement, Navajo Nation, Navajo Tribal Utility Authority, Navajo Housing Authority, chapter officials, education system, K-12 system, higher ed institution, Arizona, New Mexico Congress. We're now going into tribal consultations. There's so much that it's a demand of our online learning. Akoshik Edo Shidane, o Yugo Yenan Hines Ta di the Kwas Nasnihi Kadnahe, Dozago Hot Ego, was ho atole, Ashi and ni Yego Nantini it Okoti Sahant Ilian Hidon Hin Antini Hot Ad e Hilahuil ne Akonde. Jo bits ado e oho at bits ado e nantin o a yuhanata hasla. Hajo is hisna anisto channa nitzano hajon e anihi int iliago. Johot a enihil ho a. Ado di amma sane jaloda. Ha achina holo hatsoke hanalike. Ultra lini jo ek abayana atye. She away she yaja ultra on tondo tatine akwande ho wadene ta ho e ado he in don le kit ho nane khe ya da achina ad ultra ji inal zedle khoja o sahanane into kit ko snanane kie jo as at ultra olyeni ho wande to ho a ko at Hashine la achinen lini ikede that the nesli o ado hashine la e deko klago yuho wato ultra oko as oko ultra lini ajipenat lini to edo sato bansalan nat ani dan la aj akoti akot Ilkilta huil na dot arbes na hini jo eshi na hasala ado bits ado be na need hindo be ohidil as o you going to east case got Okohun sako eya koto ben hilna which net o leto shikedo shidene ye go ata holia a anishi ya atzante toto geneto khatatan hit ninde Johnny hito ohil a to ohil a okonda hot abi kadigi ka edo needs no but an hiho a okonda nasko ne je ana needs edole Sadiat ehi betri ana delti ole be khantna ne kesole nihit en lini ni ho wan has agin lini pa khanasen baso ti ni zan lini ba khoshia hajochi atati hajo yo ta hino ne ado ta hino zihe khayta tot ziho to ya at ta akho be na ho jil na tan hit ni de has twido sani eben natche Diego ta hosia chanta to kaho ta kiko tanta to kaho ta hosia ni heze don hichi abata des pa estra ades es be kha ahonosen be kha hosia kha go ta ship aden shi cha to khante etsepe ni yego ya anepe ni naho ilto ado di saho ani andalia jo ajito not anin leni bekat yikajo ba insen ko atrin lo ando lele halet a beso na do ni jo hot an tla yinan da ates kit jo ein de bekat anda do ni ha no jo hot e ha jo al tsone ba hasen sen she ado eta Ako eya koto pa hanana si o leso a chiche pelakana pesado de ne pesadi do sachito penahos a agente koti trilingual de na age kot traje not a khashne ako age ko do ihe shik edo shidne ko chata akisi jashi ashi chidichi ta isno sande be hilta hasne Dohun sodole dona ihe shik edo shidne ihe